So we are going to be, this is the panel addressing food insecurity, facilitating linkages between clinical and community partners. We're going to hear from some amazing people who are doing awesome work in the community to address some of the food insecurity issues. And yeah, because we know that health doesn't stop when they leave the clinic. It's about what are they getting access to outside the clinic too, to help meet their needs. So I'm going to go ahead and we have some PowerPoints prepped for you. And then we'll start with Stella, who's going to introduce herself, and then the slides will come up. So the first question is like, what is your organizational mission and how do your programs work to meet this mission? And we got our slides going, so.
My name is Stella. And I'm the basic needs coordinator. Oh,
it's on. It's on.
Okay. Hello. Okay. Okay. My name is Stella. My pronouns are she and her, and I'm the basic needs coordinator at Fort Lewis College. Thank you all for having me. This has been a really enriching conference so far. I'm learning so much and so nice to be with all of you. So I work at the Grub Hub, which is downstairs. So the Grub Hub is the campus basic needs center. It's been around since 2010. So we're actually going to be celebrating our 15th year very soon. It was started by students for students out of the sociology club. So a bunch of little anarchists. We love that. And really, I was hired 3 years ago to help continue growing it and making sure it still honored its roots of being a student-centered space. So there's kind of our mission statement there that was crowdsourced from a lot of student input, and I can read it. So the Grub Hub is a student-centered organization dedicated to breaking the stigma around food, basic needs, and housing insecurity. We serve the FLC community by providing access to safe and stable housing, nutritious foods, and inclusive personal care products. Our mission is to create a basic needs secure campus through a culturally sensitive, trauma-informed community of care. And this is a picture of, we have anywhere from 15 to 20 student staff that help manage the space every day. So here's some of our awesome members. Cool, thanks. So we really tackle basic needs from 3 pillars. So food assistance programs, housing assistance programs, and resource navigation. And we really want to prioritize giving students access to nutritious and healthy foods, especially foods that might be culturally important to them. So of the foods we purchase, around 90% are sourced from within 100 miles of here, which is really awesome because we have a lot of great farmers and ranchers and producers that are some of them you met yesterday, who are really doing great work for this region. We've also started, and Dalen will talk a little bit more about this, but we also source from far away sometimes just because we have students from other regions that have regional products that we cannot grow here. So, and just some more pictures. I think an opportunity we have because we source all of our produce like seasonally is we can talk to students about like where their food comes from and also like different things that they can do with their food to either preserve it for longer or the seasonality of food. So like September is kind of like the hot like pepper season where everything peaks. So we have a ton of peppers and people are like, oh my God, what do we do with all the peppers? So we can talk about roasting them and then freezing them. And then like in the winter, we might have less access to produce. So Dalen actually also here, she helped start a microgreens program in my office actually, so that students can learn about growing something that is in their apartments or dorms, and then also have some fresh greens in the wintertime before the greenhouses start producing. And then so we also really wanted to be continue to be a community informed space. So some initiatives that come out of student feedback is shown here, and I don't need to get into all of it because but yeah, we do. We're good?
Yeah, you're good.
Okay.
Yeah, no, you don't need to.
We do have, so we collect feedback a couple different ways. Every time our space is a self-serve space. So students can come in, take whatever they need, however often they need, and check out on their own. Checking out is just weighing their food. There's no means test. There's no like, We don't ask for personal identifying information. So everything is, I guess, like we just really want students to feel like this is their space as well. They can provide input at that point in time. We also have community gathering times where students can have more informal conversation with our staff, their student staff, and we also do surveys, but nobody likes surveys. And then from that, we learned that we wanted to have students wanted us to have a bigger presence across campus and in terms of nutrition education as well, which has really grown in the last few years, thanks to Marnie and a lot of our nutrition interns here that I saw. I think they're in the back, Stella, McKenna, I think Elena was here earlier too. So having a peer-to-peer model of supporting their peers about like budgeting on a student, like finance landscape, and then like using Grubhub ingredients to make food and how to cook with ingredients that they might not know or have seen before. Something that was really cool this summer was the Old Fort comes to campus once a week during farm stand season, and Stella, another Stella, she's one of our nutrition interns, did like food demos of the vegetable of the week and taught other students how to cook with that, and students were able to grab a bag of free veggies. Yeah, and I think I always put this on here just because like sometimes people are like, what are basic needs? And right, Maslow's hierarchy is, well, it's an extension from so there is also an Indigenous perspective of this as well, but we use this one just because our campus has a lot of different resources here that fit into each tier. And when we think about how we support a student, right? So if a student is come to us without food and without housing, they are not going to be able to access like safety needs or belonging needs or mental health needs. A lot of times when we talk about like self-care, right? Like if you don't know where you're going to live, you can't talk therapy your way out of it. You can't like therapize your way out of it or just like take a bubble bath out of it. So that's why we always think, okay, basic needs is kind of the foundation where we want to meet most students at and see where they're at before we start referring to all these other different layers. And then why it's important here, because unfortunately, like most college campuses, more than 2/3 of our students experience at least one form of basic needs insecurity. So that's measured by food insecurity, which is using the USDA 10-item food insecurity scale. Housing insecurity, which we're using a peer-reviewed set of questions as well, and homelessness, that's also a set of questions. So if you have questions about that methodology or survey, we can talk about it afterwards too. But that's kind of why it's important, and it's more prevalent than you think. So I think we're going to talk later about linkages, but I think that's something I want people to remember when they're working with college students, that there is a lot of things that they're dealing with now, and that's more common than not.
Thank you, Stella. And I was a student here, and Stella has really done a lot of work in the past like 3 years to really build Grubhub to what it is. So awesome job, Stella. You really are doing great. All right, so if you want to hand it over to Heather.
Is this on? Good. Okay. So my name is Heather Sorensen. I'm a nurse, and I am the program manager for Shining Mountain Health and Wellness, which Shaw introduced us to. And we are a part of the tribal health department at Southern Indian Tribe. And so we are kind of the mini public health, community health program. We are hoping to grow a little bit, but now we do have a couple of public health nurses, and we're hoping to grow and do a little bit more public health work. But as far as nutrition goes, we are kind of the hub. So, so the mission of the health department is really to strengthen the circle of wellness by providing progressive, traditionally balanced, compassionate, comprehensive healthcare to the Southern Indian Tribe and other American Indian and Alaskan Natives. So we do serve, just as a quick overview or a quick introduction. So we do serve Southern Ute tribal members and then any other natives enrolled in a federally recognized tribe at the health center in Ignacio. And so we have behavioral health, dental, optometry, pharmacy, physical therapy, our community and home health services program, and then us, Shining Mountain Health and Wellness. So we do have very, very great, I think, wraparound services for those patients. So you can go next slide. So as far as what we do, and this is a little bit like beyond food insecurity, but I think in my opinion, it's really all related, right? Because we want to make sure that people are feeling healthy and have all the services they need, both physically and mentally, to be able to even address if they are having food insecurity or other basic needs issues. So we do primarily diabetes prevention and education, nutrition education, and weight management. You guys heard about our breastfeeding support, and both Lisa and Shaw are certified lactation counselors. Shaw also does foot exams for our diabetic patients. We also do breast and cervical cancer screening, fitness memberships, cooking classes, community walks. So we do a lot of stuff. So I just wanted to sort of throw it out there. This is kind of a piece of what we do. We can next slide. So as far as addressing food insecurity, again, we really do try to provide wraparound services for our patients. And so, primarily, we feel like providing opportunities for healthy recipes and nutrition education through one-on-one counseling, cooking classes, and demonstrations. So we do that, and in my perspective, really provides a place of connection for people to come and learn some of those skills and learn how, we do a lot of meal planning and things like, cooking on a budget. And so helping some of our patients use what they have and make the most of what they have. We do assess for food insecurity and refer to resources as necessary. We don't do that in as much of a formal way, maybe as we'd like to. So we're kind of thinking about doing that a little bit more, probably in particular when we have a referral for nutrition from our health center, but I think also at the health center, which in my previous life I used to work with Chelsea at AHEC. We did a project on food insecurity and actually doing those food insecurity assessments in primary care provider offices in the Durango area. And so I would like to, as an aspiring future project, to really get that actually happening at our health center. And we're not doing that right now, but we would like to be. We do have a lot of other services beyond of what we just do in our program. We have our food distribution program, our USDA food distribution program. And then we have a really great new coordinator for our farmers market. So we're going to be supporting her hopefully in the summer. We started that last year, but we're going to grow it and make it even better this year. And then reducing barriers with support, incorporating indigenous foods and practices, and again, kind of that connection with others and really finding, allowing patients to kind of have a place to come. We have kind of a regular crew that comes to a lot of our cooking classes, and they're learning from each other and like, ways to save money and ways to, stretch their dollar or make the most out of a meal for however many, their family members are living, or multi-generations that they have living in their household. We do a lot of collaborating with other community organizations and other Southern Ute departments, again, to kind of bolster that wraparound services for our patients. We do have our community health representatives. It's not really part of our program, but part of our department, health department as a whole. And those are community members mostly that are employed by the tribe, and they are able to provide transportation for medical appointments and things. But we do a lot of meal prep and help some of those patients who are homebound or disabled to make sure that they're getting what they need, and just kind of having somebody go into the home and check on them and make sure that they have what they need. And if they don't, figuring out what they need. Lisa sometimes will go and do, a cooking session, an individual cooking session with a tribal member, just to make sure that they're like, how do you make whatever? What's your favorite food? Stir fry. I remember this particular patient. And so she went out and taught the patient and his caregiver how to make stir fry so that he was actually getting something nutritionally, well balanced and something he would actually eat and like. And then we're also doing some systems level work in little ways as we can at the tribe to really ensure that healthy foods are offered at tribal events, and that we're kind of keeping a pulse on those at different events that affect different populations. So our youth and our elders. We have a really great couple of elder, we have a sip, chat, and chew and a elder breakfast. And so trying to just connect with patients at those and then Lisa actually also ensures that our menu planning at the Montessori school that we have on campus for our kids is, doesn't have added sugar, and it has, they're not eating hot dogs every day. And, so she's kind of doing that check and balance to just, we're making sure some of those things, and we're moving toward a little bit more of some of that systems level change to make sure that we've got healthy foods at tribal events and activities, and giving people really that opportunity to make sure they have the connection, what they need, when they need it during the year, how to use fresh veggies, whatever's in season. You can go to the next page. Really quick, we just have this fun little program. It's called Shining Mountain Fresh. I can't take credit for it. Sort of like Hello Fresh, but it's a meal kit. And we do monthly for 30 families every month. And so we try to use in-season vegetables when we can, and then indigenous inspired recipes when we can. We just did this bison stew. And we actually were able to use, the tribe raises a bison. And so bison is available for tribal members. And occasionally they're able to give us that to provide these meal kits. And so this is bison from the tribe's bison that we used for that. And we've done other things to incorporate that. We did a bison meatball tasting, and Lisa made this amazing sumac barbecue sauce a couple weeks ago. It was really great. But again, kind of another opportunity for community members to come and try indigenous foods. And then this other picture is Lisa chopping and prepping a bunch of herbs we have a little mini herb garden, and we are able to use those and incorporate those into our meal kits and make sure that people kind of get an introduction maybe to eat to things they haven't used before or things they don't have access to on a daily basis. So we to incorporate that also. And then next one. We do lots of cooking classes. And so that first picture, we did an indigenous cooking class. This is from last summer. And Carlos Baca, who is a local native chef, and he comes and it's really fun. We made blue corn tortillas, and we were able to grind the corn and make them and press the tortillas. Super fun for kids, but also learning. That top picture is just about learning about the different kinds of corn. Same thing here. This is a picture of the tortillas. And then we also try to just do other fun stuff like this one. We're just making zoodles. So zucchini noodles. So another low carb pasta alternative, which is fun and maybe something that some members have never encountered before. So we do try to introduce them to new ways to eat vegetables. We've done all kinds of other kitchen skill building. So just kind of, again, those making sure that, if they get all these veggies from food distribution, like how do they use it? Like what is a turnip? I don't even know how to use that. How do I cook it? What do I do with it? So we do those sorts of things just to make sure that, the members can actually use the food that they receive. And just our contact information. So everybody has that in case they want to get in contact with us.
Thank you.
Yeah.
All right, cool. Thank you, Heather. Huge shout out to Shining Mountain. They do a lot of cool stuff, and April and I are lucky to go over to some of the breastfeeding classes and learn from Shaw, learn from Lisa, and eat some really good food. All right, Dylan.
Yacht shit Dalen Benali Unushia, Haskan Zol Nishlik, the Flana Bushish Chin, Kitla Chitni Dasha Che, Betani Dasha Nelle, Isnas Bas de Nasha, Akut Ego Dene Astonishle. Hi everyone, my name is Dalen. I'm the Cultural Food Access Coordinator for the Good Food Collective, as well as the Grubhub. And the Good Food Collective's mission is to their vision is to build a vibrant, flourishing regional food system. And they do that by a full scale of geographic scope of 5 different counties. So we work within La Plata, Montezuma, San Juan, Archuleta, and Dolores County. And we essentially act as a convener and connector for all of the stakeholders in the food system. So from your producers, farmers and ranchers, to the middle of the supply chain, food banks, food retailers, wholesalers, to the consumer. And my job at a direct service level is working at the Grubhub, native food procurement and SNAP navigation for students and community members. And then at a community level, I do work with other food assistance providers that are interested in doing the same thing Grubhub's doing with offering culturally relevant foods and best practices, how to create welcoming spaces. Yeah. And this is just our mission. I could read it. We envision a vibrant regional food system centered around community leadership, collaboration, economic prosperity, equity, in which everyone has agency over their food, health, and environment. We do this by working with partners from across our food shed to collectively build a just and thriving food system. Our model inspires and supports social, environmental, financial, and political systems in their own transformation. So one unique thing about the Good Food Collective is that um, we we act as an incubator for the organizations that are not currently like active here. Like we have a gleaning service and we have a food hub, so we act as those gaps in our community that we see a need for. And we originally started as a gleaning apple tree gleaning organization, but we've shifted to now a broader focus on regional food systems. And we do this by really, we try not to duplicate any of the programs that are already out there. We really just connect who are the existing people that are already doing this work and how do we connect those people. One of the ways that we work with healthcare providers is through our Roots of Health CSA program, which is a employee food share program that started in 2020 in the peak of COVID. There was a lot of food insecurity amongst the healthcare providers at Mercy and Centra. And so we provided a weekly sliding scale CSA for 14 weeks, and it included fresh produce from like 3 to 4 different farms, local farms, and we offered like nutritional tips and meal prepping tips with the vegetables in the bags. And yeah. So another way that we work with healthcare providers is through my role as the cultural resource navigator is working with other food assistance providers that are interested in offering culturally relevant foods and finding out where those organizations that serve the most of our Native and Indigenous populations and doing workshops with them with Tumbleweed Nutrition, Danae Becks, and using those culturally relevant ingredients. The Good Food Collective is like a sisters organization of the La Plata Food Equity Coalition. And so this coalition meets once a month, And we asked essentially the community what they would need to be food insecure. And so that included um, agency, food entrepreneurial opportunities, community, sense of belonging. And so they created these different work groups to uh, really spearhead the initiatives in these areas. So this shows an example of how our food system is holistically and with social determinants all like determine whether or not we're food insecure. And so yeah, we even have a language justice work group that has really helped Spanish primary speakers get more access to food insecurity, like if they can't read the application or things like that. Yeah. And then right now, one of our projects we're working on is building a La Plata food system plan. And this will act as like a 5-year roadmap that's built off of community input to give the local government and these different institutions like, hey, this is what the community said they wanted, and this is how they said, this is how we strategize to fix it. Yeah, and so we're in the development and strategy implementation phase. And so, yeah, we're gonna have like in town hall meetings and things like that. And we've had previous focus groups, and the top 3 focuses were land access, policy and funding, and culturally relevant food access. So these are like the main issues that we're seeing from the community. And then this is just like a way to get involved. The best way to get involved is through signing up through our newsletter. And then a lot of the opportunities with the La Plata Food System Plan and the Roots of Health program, all those can be found in our newsletter.
Cool. Thank you, Dalen. A lot of things happening in this little area. So I'm gonna go ahead and hand it over to Pam. Who will talk to us a little bit about what they do.
Ready to go?
Mhm.
Y'all doing? It's almost lunchtime. I'll be quick, maybe. So I work in the Pine River Valley, Los Pinos watershed in the eastern part of La Plata County. And 275 square miles, about 20,000 people.
You might want to hold the mic just a little.
Y'all hear me?
closer.
Oh,
Yeah,
gosh,
there we
there it
go.
is.
There we go.
So that's out there. It's 275 square miles from the mountains to the mesas, from the river to the Pine River, Vaisita River down to Navajo. So we're in that area, an area traditionally held by the Southern Ute Nation and still shared by the Southern Ute Nation. So that's where we are. And about 12 years ago, we just stood up an organization, a collective to start filling the needs that weren't being met by the people who live there. And we knew we'd never have money, and we didn't have any hierarchy, and we acted like a bunch of hippies, but we got shit done. So, and the way we would do that is by like a true social justice project. We would go say, what's getting in the way of us being able to thrive where we live and thrive here in this space? And so we heard all of that in a consistent theme over and over again. And this is not formal. So assessments, no. Community meetings, potluck dinners, and talking like that, yes. But it was pretty informal in the way that we build relation with what we consider all of our neighbors and identifying what the needs are. So, or where we struggle. So that's what we did. And then a consistent theme to this day is access to affordable, healthy food. And those are 3 different strategies, So affordability is a really economic issue. Access is about where is it? Because we've got 2 grocery stores. And often one grocery store doesn't have anything that's local, fresh. One of them does. It's often hard to get to. We don't have reliable transportation. So it's an economic issue. People's incomes don't match what they need to live where they are. So I always want to check that because I think it's real easy for food pantries to say, oh, we're feeding the hungry people and the food insecure, and all of us as humans relate to that, innately. And so, but I think I think we have to tell the truth about it. It's income disparity and rising costs, lack of jobs, lack of infrastructure, lack of transportation that are keeping people without eating healthy food. So, in the process that we use, you know, I'm such a nerd, but I have handouts.
Mhm.
Our mission is, do we have a mission? Do we have a thing?
No, but
No.
we can.
Okay, so we have this. So we
You want me to
say,
hand it out? I'll hand it out.
we say our mission like a pledge when we meet. We hold weekly meetings. So after we have an initial meeting where we ask everybody what's happening in your life that's impacting your ability to thrive right here. And we had a lot of people and we fed them all and they all came and we identified these things. And I said, what can we do about it? Right here. What are some ideas that we have that we can do for ourselves about these issues that are impacting us? And I came up with a whole bunch of stuff and I said, well, you guys want to work on this with me? Can we do it? Let's get together. So we picked a meeting date that happened to be 9:30 on a Wednesday at the library. 13 years later, we still meet at 9:30 on Wednesdays for open community leadership meetings. We just don't do it at the library anymore. We have our own building now. So it's like a lot of movement there. But we work in that way. So, and what you've got in front, our mission is to bring together the knowledge. First of all, we're a social justice leadership project. We bring together the knowledge, skills, and resources of people in the Pine River Valley to increase our collective power and bring about positive social change that results in healthy, thriving communities. So it describes a process. It's not a thing, it's a process. And that process, for nerds that are all into this kind of stuff, is popular education. I don't know if anybody, does anybody in here know what that is, popular education facilitation? It's another kind of name perhaps for social justice organizing, where you pull people together that are most impacted by an issue. Folks in that group talk about how it's impacting them, build a joint analysis, look for root causes, identify impacts, and out of that, a strategy for action. Everything Pine River Shares does operates on that. Every meeting we come back to and say, well, how'd that go? But what we're doing is studying our own lives. And rather than other people studying us and telling us what this is, we're looking at our own lives. And if there are people missing from the table, we go find them. We move ourselves into the community. So we're organized throughout the Pine River Valley. And we do a lot of things that way. So y'all with me so far? So this little thing I made at the last minute, like 11 on Wednesday night, is an update. We also do a 2-year strategic work plan. So how do we know those barriers change? Sometimes we create big change in our communities that result in fewer barriers over here and more over here. So every 2 years we engage in this process of listening to the community. We have youth community organized in Bayfield and Ignacio and up north in the Valle Cedar Forest Lakes area. We have seniors organized in the south down in Allison. So all these groups, they meet every week, they get together, they're looking at barriers, they're developing resources, and they're sharing that peer to peer. Over 180 people are engaged in implementing these programs. So they're doing the analysis, they're looking at the root cause, they're implementing a strategy, and I pay them a stipend that says thank you of $25 for 6 hours. We don't have staff. We have me and this other person, Sarah, my co-partner in this, that manages all of this resource and all of this process as the people on the ground are saying what we need. So what is that food related? I'm always telling people, our mission doesn't say food. Why do we do so much food, you know? And now I relent because I think it's so well connected to everything else, every other social determinant that is driving the struggle that people are facing in our area, and I might argue in other rural areas as well, and tribal nations, are those social determinants. It's this income disparity. It's not right to be living in an agriculture area and have 200 households a week show up to get food. That ain't right. So Pine River Shares does food shares in Ignacio. We do food shares in Bayfield and Allison. We do food deliveries. We pack 200 backpacks for kids every week for the Ignacio schools, for the Bay, and all this volunteer. $35,000 a year is what I pay, and $25 implements to get all this done, to mobilize these communities to do that. So in our pursuit of, we also have to keep listening to the people that are most impacted by the things that we work on. You can see we do a whole bunch of things, and I'm just going to zero in on food. We have a Food Equity Leadership Council, and it's comprised of people who are getting food from us. And we meet with them quarterly to find out where we are, what's happening in the world, what are barriers to accessing food, what can be done differently. And so everything we do is dictated by that group in the food arena. We have learned over the last year that 80% of the people who receive food from us get food only from us. That means they're not going to the grocery store. They're not getting it Forever's Fresh. They're not getting it, and that shifted our focus a whole lot. Because the food that food pantries get, maybe not Grubhub, but the food that food pantries often get is secondhand food. It's canned goods. It's high in salt. It's not good for you. And so we really made a strong effort to stop buying that stuff and start buying from local producers, meat, honey, jams, everything, and working in partnership with the Four Corners Food Coalition. I don't know if any of our partners are here from Mancos and Cortez. Kirby would have been here helping me with this. We worked together to do joint purchases to serve the people that we make. So we started doing that, and in 2019, we began a process called Field to Fork, where we went into all the communities in our area, and asked what the barriers to accessing healthy food are, and introducing them to history. We have a lot of historic records, beginning with a native record of food acquisition in the Pine River Valley. And then we studied 100-year-old farm narratives from out there. So we were able to go into each of these communities and say, this is what we used to grow here. This is how we used to process it here. This is what and we knew that we had this rich tradition of working together. That's why we're organized like we are in this watershed. And so that was a 2-year process of doing that. And we put together a plan called the Field to Fork Plan. You can see it on our website. And then we've been working steadily in that direction. We give away gardens every year. We put gardens in every year. Skills shares and food share, all those kinds of things related to implementing that plan. And then COVID hit. It's like, damn, we were not prepared for that. The food wasn't on the shelves. It wasn't available to us. We had a woman call and say, I've got COVID. I can't get out of my house. And I've been calling everyone to get some food. And I've been out in the backyard planting potatoes because I'm afraid that may be the only food she was terrified. And so right in the middle of COVID, we started, we're located right in Bayfield. We're in a school district. We broke ground. We put in a 2,000 square foot garden. We planted 28 heritage apple trees and built a geodome. It's like, we're going to start growing food now. We're going to be on this mission. And we've been doing that for a while and infusing more and more local foods purchased locally, and then local foods that we produce. And then last year we bought a farm. So it's like, you can only work and try to bend systems so much before you just say, screw it, we'll do it ourselves. And so we bought a farm. These people came, kept telling me, I got a farm, Pine River Sheriff's you need to have this, you need to have this. And I said, I don't have any money. We run about a $200,000 budget. It's like tiny for the work we do. Come see it, come see it. No, I don't want to see it. Come see it, come see it. No, I don't want to see it. I finally went to go see it, and it wasn't a farm like I was thinking about, livestock and like that, barns and stuff. It was a nursery farm. So they used to grow plants there for nursery, wholesale. 28,000 square feet of greenhouse space, all of this in ground. Designated, it was incredible. 3 holding ponds, irrigation. That's the farm they wanted us to have. And so we worked with them over a year, and over the course of a year to try to figure out how we might be able to afford that. And we got a little bit of money from the county and some grant money, and the rest of that $500,000 was raised by the people who live out there in about 6 months' time. And I will say to people, I could not raise $50 for a food bank in 6 months, but I can raise $500,000 to grow food in the community. So what we're doing out there is really trying to reframe. We're building our own food system. The Field to Fork system is our plan, is our blueprint to how we rebuild the food system that we once had. We know we used to have grain mills. We used to have 8 dairies. We had what we needed: storage lockers, community places to process food. People grew food at home, and they worked to process it together and store it together. So we've been working on that for a long, long time. But the people we serve work 3 jobs. They work hard jobs. They work over here. They're not going to go home and grow food. So that's where the farm comes in, and we're trying to rebuild the food system and also make a scalable food system. Something that is, so we're not trying to serve. We don't care about supply lines. My supply line is North Valley Cedar all the way down to San Juan, New Mexico. So that's where we're really working. I'm going to stop right there. Last year, our first year out there, we've been actively converting the farm to a food farm, putting potable water in, walk-in coolers, all that kind of stuff. And this is volunteer labor, y'all. This is like volunteer stuff putting us together. And we put the farm in. Our first year, we grew 5,000 pounds of food. We distributed, had 2 little contracts. Thank you, Good Food Collective. One of those was with, so it enabled us to deliver fresh vegetables every week to the food shares that we do at Pine River Shares. And the other one enables us 16 weeks of produce deliveries to the senior center in Bayfield and the senior center in Ignacio. And we just, it was like a free market, kind of like Manning used to set up the free market. And people would come and take the vegetables they wanted. We provide, like you guys do, provide recipes, provide traditional recipes and traditional sources, but nothing compares to just the communication between the groups like that. Just people talking to each other. Well, this is how you cook chard, and this is how you do that. I'm going to stop right there because I could go on and on. I think we're on to something, and come see us sometime. The farm is, if you're going towards Bayfield, you go through Gym Village. Y'all know where I'm talking about? Some of y'all do know. Okay. And we're right on 160. Call me. There's a phone number down there. And if you're interested at all in the process that we use to do all of this and mobilize communities, it's right up here.
Thank you so much, Pam. All good. Yeah, a lot of good work coming out from Pine River Shares. Actually, Stella and I got to visit it, and it's a really neat operation you guys have going on over there. All right, so now let's talk about collaboration. So how do you envision your organization working with healthcare providers throughout the region? And what role do you see healthcare professionals playing in helping you achieve your mission? We can start with Stella. You got the mic.
Okay. I want to say I really appreciated like Danae's presentations yesterday about like treating her patients and clients as like whole people and meeting where they are. Because I think that's something that we try to emulate at Grubhub, but also like something that I think that we could work closely with healthcare providers on is just like understanding the student experience as it exists now. And know that like most students, and this is based on FLC's averages, right? Most full-time students are experiencing at least one form of basic needs insecurity. They're also on average working 20 hours a week. And if you are a full-time student, your credit hours are the equivalent about 40 hours in class and out of class time. So if you're working 20 hours a week on average, that's already 60 hours of your week, not to count like everything else that they might be juggling. So I think when working with patients or that might be struggling with their nutrition or like have other healthcare concerns, I think it's really important to ask like, what do you have access to? Like, what is the challenges that you're facing? And also I think I see our basic needs team kind of lives within what's called the student well-being team. So we are also thinking about like harm reduction efforts and moderation campaigns and all the other aspects of wellness that might be part of their experience. So what I see sometimes with students and maybe their hesitation with like, well, one is time. They just don't have time to see a healthcare provider or be proactive about it. And 2 is like the resources of not realizing if they can afford the potential bill that they'll see. But also 3rd, they're worried about telling their whole story, I guess, when they go. So just understanding like if a student, you know, we all get those screener questions of like, I don't know, there's like every doctor I've gone to has like their own version of it, but maybe including some questions around like food security and access to stable and safe housing, I think is really important. And if there are questions about like substance use, being able to approach that or like mental health challenges, being able to approach that in a holistic way and not a shame-based or like paternalistic way, I think is really helpful in treating, I don't know, like building a really good relationship with that student and actually be able to support them with what they do have access to and what they can manage in their life. So yeah, I think that would be a really helpful conversation if there's any healthcare providers. I know with our own health center, we talk a lot and also just increasing access to Medicaid as well. So if there are underinsured or uninsured students, we do have 2 health insurance literacy specialists that come to campus that help students get connected, whether it's through like IHS, Medicaid, or kind of open, what is that called? Open market options. And then also knowing that there's like different resources that they can access to through either our campus or community that I'm like trying to think of a good example without giving away information about, but like I had a student client recently that was really struggling to find the time to even cook for herself. And then I realized it's because she's like taking 18 credits. So times that by 3, right? I think that's the multiplier now to figure out the hours, and working 2 jobs and also sending money home. So all she could manage was eat a granola bar during the day. And then because she was so stressed out, she was also using like substances heavily to like try to alleviate some of that. So we had to work out something where we're like, okay, how can we look at your financials and figure out what pieces that we can provide support for? And then in terms of like your academics and other things, what can we do to make things easier, and what classes maybe can go online so that you can be home like taking care of your family while also still getting classes? Or is there like, can we get you connected to Snap and stuff like that? So just like, I think takeaway is like trying to see the whole picture of a student rather than the immediate problem that they're facing.
Yeah. Dylan, I know you talked about it a little bit, but do you want to expand on anything else of how healthcare providers can work with Grubhub?
I'll just mention that the Good Food Collective, we meet with all the food assistance providers, and that includes like WIC and like the produce program, Fresh to Flourish, that the hospital has. And so just knowing about these programs and knowing how to support them, I think is really our place. Again, like we're not trying to like duplicate multiple efforts. But yeah, we're aware of the system's whole effect and the whole impact it could have on a person. And yeah, so yeah.
Thank you. Heather? You're on mic.
So I think I agree with you about not making assumptions about whoever you're talking to. As a healthcare provider, I think I've been on both sides of your healthcare provider, and you've got your little 5-minute slot with your patient, right? And you've got to do your 20 things. And obviously assessing someone's basic needs is kind of a conversation that takes some trust and it takes some time. And unfortunately, healthcare providers aren't always able to do that. So I would say, especially from a representative from Southern Ute Tribe, I think just an awareness of, cultural ways of knowing and indigenous practices that I think even more so I see for indigenous patients, that trust piece is really difficult, and they may not disclose that to you. And I think same thing for students. It's like you're just supposed to be going to college and you're just supposed to be plowing through and like figuring it out and whatever, eating your ramen and your mac and cheese and your granola bars. So I think just trying not to assume, whoever walks in the door, whether or not they may have food insecurity or not, right? I mean, we all know how much has increased, especially recently, and just cost of food and people's situations and cost of housing, and right in this region, right? We all know that's a really crazy struggle for a lot of people. So I think that's really important, is again, yeah, just not assuming whoever you have in front of you, that they may or may not have an issue with food. And then, and again, I think making sure we're just really helping people start where they are. I think most of us nurses kind of learn that, but it's still really hard, especially in most systems, for you to be able to slow down enough to actually find out and to ask those questions of patients. And so I would just really encourage healthcare providers, to be thinking about this and just put yourself in their shoes. When you have something like food insecurity, it can be humbling, and people just need a minute, right? And they need the space. So if there's a way that you can slow down and give that person a minute to share with you, especially if you're asking those questions. And I think actually a lot of people, when you ask them, and I know that when we did this with healthcare providers, one of the things we found out was that people didn't know, healthcare offices, that actually healthcare staff also are experiencing really high rates of food insecurity. And we know that from Good Food Collective too. But again, anybody can be experiencing it. And so just really trying to take the time to listen to people. And even if you can just ask that one question, have you in the last 12 months, been able to meet your needs with food or something around, there's the formal questions, but there are a lot of different ways to ask that. And just giving people the space to actually answer, and you'd be surprised what they might answer. And it may just be, hey, I didn't know that Pine River Shares is down the road. It might just be handing out the resources. So I think that's the other piece, is having those resources. You may not need to know everything about them, but just, healthcare providers having those resources and having them semi up to date, and taking a minute to call, and just say, are these still your hours? So that you're not handing somebody something. I think I've heard that's very frustrating. Patients go to get resources and then they're not up to date, right? And then they're like, they walk away and they're like, yeah, so that's just another instance of them not helping me. And then they're frustrated. So I think taking the time to just even call and make sure those are correct is important.
All right,
Just say real quick thing on that. We learned right away.
gotta speak in the mic
even
on
though
this one.
Food insecurity, people, or access to affordable, healthy food was the biggest barrier. There was a food pantry in town hall when we first started organizing. Nobody ever went to it. Nobody. And so we were trying to figure out, well, how do you deal with that? And we knew some people were coming all the way over here to get food, but that was difficult for most. And so we had this idea, actually from some guys that I was working with at Manna that live out there. They said, there's no way in hell we're going to go to a food pantry, Pan. You're just going to do that. That's not part of the culture out here. We're the helpers. We're not the ones that take help, So what we did was we threw a community dinner, and we went down to the food pantry, and we moved it all to the gym where we fed everybody. It was a big old community potluck dinner. And in the back of the gym, we had all that food sitting there and some bags, and it said, with signs that said, help us get this food into the hands of neighbors who need it. Gone. The whole table was gone by the end of the night. So that's why we kind of come up with this idea of Pine River Shares, that everybody's got something to share, and you've got your labor, and sometimes you've got extra food, so that people don't have to ask. I work with students in the Ignacio High School, and they do the same thing. They're going through this process, looking at barriers that are impacting their blah, blah, blah. And a couple of years ago, we started a student pantry in the school. They always come up with this. I think food insecurity at Ignacio High School has always been really high. And so the kids were doing this, say, well, they won't come take our food. We made all this, we set it out, they won't take it. And we kind of did the same thing, put it in their pathway so they don't have to ask. So put people in a position to ask. And so I would say, let us get our little flyers in your place that has that information there so they don't have to ask, and then being aware that I really want to say echo what you guys are saying. And then the other thing is we're a peer network. A lot of people will never ask. And so that's why we try to keep all these volunteers and people up to snuff. That's why we have all these meetings. So they're identifying resources, what's available, and they can tell their peers and their neighbors who might not know that. Some people will never ask. And just to reiterate, we have economic assistance, we do financial aid, we've got a free cycle clothing unit, we do a lot of more things than just food. So call us.
Thank you, Pam. I think we are at almost time.
Yeah, if the audience has time, it has some questions,
Okay.
we probably have time to take a couple of questions.
Couple questions. All right. We have a question in the back. Let me grab a mic. Okay. I'm coming. No, never mind.
Okay, I think, all right. Yeah, I guess this is for maybe Good Food Collective and Pine River Shares. Well, actually, I don't know. Maybe I'll start with Good Food Collective. They mentioned it, but the La Plata County, sorry, La Plata Food Equity Coalition, sounds like it meets once a month. Who's attending that? And then is that something that just regular community members can be involved in?
Yeah, the La Plata Food Equity Coalition is led by community members. And it's once a month, like 1 hour, and yeah, anybody can join. And you can get involved with that by going to our website and signing up for a newsletter, and then there should be a LFPC sign up. Yeah, it's virtual, and then sometimes we meet in person.
Thank you. Any other questions?
Hi, Jess Church again from Common Spirit Health. I'm curious, so I work in our National Office of Community Health, and we have quite a few initiatives looking at ways to expand the networks of community health representatives, as they call them, in our tribal communities, and community health workers, as we call them, perhaps at a state level. I would love to hear from you all, what is your vision of how to incorporate those community health workers in the spaces that you all work in, to better connect healthcare with community.
Is this, no, on? Okay. So, I will say from the Southern Ute Tribe perspective, our community health representatives could be doing more than they're doing. And we know that, and we're, unfortunately, it's always the turnover in those positions is hard. So we're always feeling like we're fighting that. But I know that, and they want to be doing more, right? So, I think training is one of the biggest pieces, and making sure that those community health representatives are getting adequate training so that then they could step into some of these spaces and kind of be more helpful. But I do see that they could be very helpful, because ours in particular they're in the homes, and they know, they're going out to, so-and-so's house, and they know exactly how much or how little food is in their cabinet. So, and they have that trusting relationship. And so I think we could definitely be using those staff and community health workers too. I would agree that they could be making the connection between food, making that connection between food and health, right? And so I think that's really an important space that they could fill, is kind of, connecting the food resources to some of those patients that really need it, and making that connection between it can better your health, or it could improve your diabetes, or, it could increase your ability to be more physically active so that you're not so frail, so they're actually getting nutrition. So I think in a lot of these spaces, they could be really helpful in all kinds of ways, whether it's delivery of food or assessment. I think food assessment would be a really easy way for them to be involved, like some sort of, they could easily be going into homes either, or if it's online, helping to do actual surveys and assess, because I think that's actually lacking for us to really know who really needs and where the needs are. So does that answer your question a little bit?
So we've started doing more peer-to-peer models here. So, and because we found that it's a lot more effective when like someone who understands what you're going through is like providing guidance or something. So I wonder if there's an opportunity to grow our like peer support office to have that aspect as well.
Thank you. Do we have a Zoom question by chance? No Zoomies, okay. Yeah, community health workers, super supportive in the work of connecting the dots and to improving health. So, and we know that because of Now a Nation, they have a lot of community health workers in the community. So, any last words? I think we're at time. Are we at time? We're at time. Okay. All right. So let's just wrap this up. Thank you all so much for your valuable insights today. We really appreciate the work that you do. And yeah, for your expertise and sharing how we can make connections with more.